Alzheimer's Dementia. Introduction. Dementia is a normal sign of aging. Select true or false. Correct. Dementia is a disease caused by damaged brain cells. It is more common in older people than in younger people. However, dementia is not a normal part of aging. The signs of dementia in Alzheimer's patients are predictable, but the amount of time it takes to get worse is not. Select true or false. Correct. Both the symptoms and the amount of time it takes to get worse are unpredictable. People in the early stages of Alzheimer's disease are usually put in a nursing home. Select true or false. Correct. In the early stage, an Alzheimer's patient is forgetful but can take care of him or herself. Which of the following do Alzheimer's patients usually lose track of first? 1. Faces, who people are. 2. Places. 3. Things, what things are. 4. Time. Correct. Patients usually lose track of time first. Over time, people with Alzheimer's disease become more aware of their memory and function problems. Select true or false. Correct. In later stages, people with Alzheimer's are less aware of their memory and function problems. Over time, people with Alzheimer's disease can handle stress more easily. Select true or false. Correct. In later stages, people with Alzheimer's have more trouble handling stress. They may become nervous and argue a lot for no obvious reason. People with Alzheimer's disease usually lose the ability to read and write after losing the ability to take a bath or a shower. Select true or false. Correct. All people with Alzheimer's disease go through the 4 stages and experience the same symptoms. Select true or false. Correct. Even though there are stages of Alzheimer's, symptoms are different for each person. People with Alzheimer's disease are more likely to be confused at sunset than at sunrise. Select true or false. Correct. This is known as sundown syndrome. The Alzheimer's patient enters another family member's bedroom by mistake. Which of the following is the positive way of communicating with him or her? Choose one of the following options. 1. This isn't your room. 2. Let's go for a walk. Correct. This is a positive way to communicate. The Alzheimer's patient says he has to go to work today. Which of the following is the positive way of communicating with him? Choose one of the following options. 1. You're not going to work today. 2. What should we have for lunch? Correct. This is positive communication. The Alzheimer's patient says she has to go home. Which of the following is the positive way of communicating with her? Choose one of the following options. 1. Tell me about your home. 2. No, you're not leaving. Correct. This is the more positive way to communicate. The Alzheimer's patient says she wants to see her parents today. Which of the following is the positive way of communicating with her? Choose one of the following options. 1. Sorry, but your parents are dead. They have been for years. 2. What did your father do for a living? Correct. This is positive communication. The Alzheimer's patient says it is hot and he is going to take his clothes off. Which of the following is the positive way of communicating with him? Choose one of the following options. 1. Which shorts do you want to wear? 2. Don't take your clothes off. Correct. This is more positive. The Alzheimer's patient keeps turning a light on and off. Which of the following is the positive way of communicating with him or her? Choose one of the following options. 1. Have you met our new neighbors? 2. Leave that alone. Correct. This is the more positive way to communicate. What should the person speaking do in order to communicate better with the Alzheimer's patient? Tom, it's Bill here. Since your daughter Anne and son-in-law Jim are visiting today, we need to get ready because they will be here after lunch. Choose one of the following options. 1. Use shorter words. 2. Use shorter sentences. 3. Call the person by name. Correct. The second sentence covers several ideas. He could have said, "Let's get ready. Anne and Jim are visiting after lunch." To help a patient with Alzheimer's understand a question, it is best to rephrase it. Select true or false. Correct. Unlike other situations where it helps to rephrase the question, a person with Alzheimer's is best helped by asking the same question again. Body language does not help the Alzheimer's patient understand a message. Select true or false. Correct. Nonverbal messages are more important when talking with demented people. How could the men communicate positively with their grandmother? Choose one of the following options. 1. Tell their grandmother they will get a note from their mom for missing school so they will not get in trouble. 2. Show their grandmother their IDs. Correct. This would solve the problem and they could go on with their visit. When a loved one with Alzheimer's is calling or looking for their mother, father, husband, or wife whom you know is dead, how do you handle the situation? Choose one of the following options. 1. Do not tell them their loved one is dead. 2. Tell them their loved one is dead. Correct. It is best to change the subject slightly by saying something such as, "Tell me about your mother," or "What did your husband do?" Which of the following is a better way of communicating with an Alzheimer's patient? Choose one of the following options. 1. Hi, Bess, do you know who I am? 2. Hi, Bess, I'm Carrie, your niece. Correct. It is best to call the person by their name and identify yourself. You visit your grandfather in the nursing home. You want to take him back to his room. Which of the following should you say? Choose one of the following options. 1. Do you want to go back to your room now? 2. Let's go back to your room. It's time. Correct. Avoid asking a demented person questions that might force him or her to make a decision. Thank you for using Explain.